All right, so now it is official. We are live on three platforms, or I should just do the three, just so I don't count the six. Three platforms available on Facebook, Instagram, and YouTube as well. There is going to be a little bit of a delay just because we all know how the internet works, but feel free to ask questions. I will get to them eventually, right? And I may just kind of wait till the end to get to the questions. So, first of all, again, I want to thank everyone for coming out to another live stream video of yours truly, Dr. Pierre, your favorite board certified internist, founder of drbarrypierre.com, host of the Lunch Learn with Dr. Barry, host of the Empower Yourself for Better Health series, as well as CEO of Pierre Medical Consulting, helping you empower yourself for better health. This week, we have episode 65, where we're going to be talking about men's health. And most importantly, we're going to be talking about why the lack of men's health, right? And really the lack of the awareness associated with men's health is literally killing people left to right? And especially men, right? Literally, because of course I'm biased, right? I'm a man, right? But like most importantly, like, this is the month of June. So in the month of June is when we kind of yell out from the rooftops, like, hey, this is Men's Health Month. Hey, let's kind of get this thing together. And we are definitely going to do that, especially for what I have planned for this month for you guys. So I want to kind of start out and say, why are we even talking about it, right? Like, why is Men's Health Month even a thing, right? So this is something that, and again, we talk about this a lot with our health-related illnesses, right? Like, that's always a question, right? Like, why is it so important that we designate a full-blown month to this issue, right? And I think Men's Health Month is big. One, because we know that there's a lot of different things that we, especially in the medical field, the public health field, could be doing, right, to like ensure better quality of life and longer living lives, right? And unfortunately, we have to kind of highlight the men, right? Because, and again, women, and for those who may already ask me, Women's Health Month was last month, just in case you're wondering. Whatever. But Women's Health was last month. This month is Men's Health Month. We're going to be dedicating a few podcasts, a couple blog posts this month, specifically dedicated to talking about men's health and really kind of getting us in together, right? I'm 35 years old. I'm a practicing internist. I take care of patients in the hospital. But time and time again, I see issues that are consistently affecting men at such a rate that, like, if someone could just talk to them, right? Again, remember, I started out outpatient medicine, right? If someone would just talk to them and say, like, hey, like, go to the doctor, take your blood pressure medication, take your cholesterol medication, they wouldn't end up in the hospital to see me, right? Like, I tell my patients all the time, hopefully you never have to see me again, right? Hopefully you're in the hospital, something happens, you get sick, but then you get better, and then you don't have to ever see me again, right? Because that's really the crux of it all, right? So I just want to, again, we got a little bit of a, again, I'll be reading from my notes, right, just to make sure we are getting up to date, right? So Men's Health Month, again, the goal, right, is increase awareness of preventable health problems and encourage early detection and treatment among men and boys, right? Men and boys, which is really important, right? Because for women, right, women, they have a viable reason why they have to go see a doctor much more frequently, right? Because of the pap smears and everything else, right? So they have to go see, right? Unfortunately, because men don't have that type of preventative testing that has to occur at such an early age, we don't get, in our mindset, even when we're young, right? There's not a pattern of us having to go see a physician, right? So we already, starting young, we already dropped, the ball already gets dropped, right? And when we talk about men's health, this is something that's actually started like in 1994, right? So 1994, when the stat folks were looking around, they said, like, hey, you know what? Men are dying earlier. Men are suffering from a disease a lot more, and if we don't do anything about it, it's going to be a problem, right? Fast forward to 2019, it's still a problem. So Men's Health Month started out as a week, and actually as a day, and then it kind of progressed as a week, and now it's a full-blown month, right? So full-blown month to really say, like, hey, we need you guys to get yourself together, right? We need you to go to the doctor. We need you to, like, just do what you're supposed to do, right? Because that's the problem that we're having here, right? Because no one's just seeing a doctor. And I can tell you, I've talked about this before in the podcast, that the two common reasons that a man will come see me in my office, one, their significant other said, hey, you're going to the doctor's office, right? Whether, and not even saying the other mom, because it's like someone in their family was like, hey, you need to go see a doctor, right? So that was usually one cause, right? Number two, sexual issues, right? There's usually some type of sexual dysfunction that caused that forced me to end up in my office, right? And usually I can tell you what happened, especially when I used to do outpatient medicine. Patient come in for a routine checkup, or maybe come in for like a random cold, something that really has, really nothing that would usually cause, especially my man, to come into the doctor's office. And then right when I'm about to leave, it's all right. Any other questions? Well, doc, I am having some issues, right? So again, those were usually the two biggest reasons why someone would come in my office to get care, right? And we can't have that anymore, right? Like we can't have a situation where the only time you're going to see the doctor, right, is if you have sexual issues or someone's forcing you to come to the office, right? And so I want to kind of, especially here in the lunch learning community, I know a big thing for us is trying to understand, like, well, how big is this here? Like, how big of an issue should I be worried about this for, Dr. Barry? So we're going to list the top 10 causes for men dying, right? Like, again, we're going all the way to the best, right? We're going to list the top 10 causes for men dying. And then I want you, as you're watching this video, right, I want you to kind of think about like, I wonder, it's for women, right? I wonder who dies more, right? So this is just the top 10 causes. So number one, again, this is no specific order as far as how often. This is just 10 causes, like right off the bat. Number one, heart disease. Number two, cancer. Number three, unintentional injuries, right? Those are your accidents, slip and falls, those motor vehicle accidents, those things like that. Stroke. Number four, COPD. That's our lung disease. We were very familiar with that. I know you guys see this commercial of this, a random person sitting by, they're usually by a lake, right? And they're saying like, oh, I can't breathe, but now I can breathe because I have that inhaler. But they usually don't tell you like, oh, I can't breathe because I was smoking cigarettes for 20 years and now that's the reason why I can't breathe, but not here or there. Diabetes, pneumonia or influenza. So to the suicide, big one, kidney disease and Alzheimer's, right? So those are in 2019 the top 10 causes for men dying, right? And again, and not any specific order in terms of greatest to least. Those are just in general the top 10 causes for it, right? So again, we're gonna list them again: heart disease, cancer, unintentional injuries, accidents, and it kind of falls in that same picture. Strokes, COPD, diabetes, influenza or pneumonia, right? So kind of infectious cause, suicide, kidney-related diseases, and Alzheimer's disease, right? So I want you guys to kind of think about, those 10, right? I want you to kind of think like, well, in comparison to women, right? Because what tends to happen, especially whenever, it's so funny, whenever I focus on one side versus the other, right? The other side always wants to know like, well, who suffers from it more? So suffer from it for, right? So when those 10 I listed, so list here which ones do men suffer more from, right? And you guess, right? Like if you had to think about it, right, before I list them, right? If you had to think, is it 2 out of 10? Is it 5 out of 10? 10 out of 10? I don't know. Like if you had to think like, all right, so men are suffering from diseases. These are the top 10 killers for men. Like do we suffer it more than women, right? Because that's always the question, right? So let me see. Heart disease, men suffer more. Cancer, men suffer more. Injuries, men suffer more. Strokes is actually pretty even, right? COPD, men suffer more. Diabetes, men suffer more. Influenza, pneumonia, men suffer more. Suicides, men suffer more. In fact, men suffer almost 4 times the rate, right? So just to kind of give you an idea. Now, again, these are deaths. There's not attempts, because I know the studies that show that women attempt suicide more, but men actually die from suicide more, 4 times as much. So just to give you an idea. Kidney disease, men suffer more. And then Alzheimer's disease, right? You know what? That's the incidence kind of skews towards the women, right? So, and if you think, I want you guys to kind of think about it, right? I just listed those 10 diseases where men suffer a lot more than women. Alzheimer's disease is usually age-related. So what's tend to happen, unfortunately, right, is we're not even living long enough. Like I'm almost sure if we were living long enough, we would probably suffer from Alzheimer's disease more than deaths from Alzheimer's disease. But because we're not living that long, that's usually not the case. I used to work at rehab. I used to work in rehab facilities and skilled nursing facilities, and the ratio of women to men was sometimes 2 to 1, right? Because men aren't making it long enough to need a rehab facility or a nursing home, right? Because a lot of us are dying that early. So again, just to kind of, again, really, again, I don't want to paint this, gloomy picture, right? Because that's really not the crux of or at least the goal of what we're doing here, right? We're not here to paint this gloomy picture of men and health, men and death, but we're really trying to hit home the fact that we aren't taking care of ourselves. Again, men, I'm talking to you guys here in the lunch learning community. We aren't taking care of ourselves, right? And because we aren't taking care of ourselves, these things are happening. And some of the things that we need to do, some of the easiest things that we need to do is just going to see your doctor, right? Like for those who are watching this, I want you to think about, I want you to think about your closest male relative, loved one, friend, somebody, and think about when's the last time they talked about going to the doctor's office, right? I just want you to just think about it. Again, I'm 35 years old, right? So I want you to think about around my 35 years old, when's the last time they said, oh, I just went to the doctor, I got my annual visit done, right? That's not a conversation that happens, right? You tend to hear it more with women, right? Yeah, I just had my weekly checkup, just had my yearly checkup, you hear that because women are always much more conscious and forced to be much more conscious about their health. Men, unfortunately, have slacked to the wayside. And I'm going to beat the horn as loud as I can to really kind of drive home the fact that we don't have that ability to do that stuff anymore, right? It can't happen, right? Like if we are going to, if we're all about, us, right? Like we're going to the gym, we're doing all these things here. We also need to go and get our checkups, right? So that's the problem. That's really, and that's why a month like June, right, is so big, right? Because it really stresses hey, look at all of the problems men are suffering, right? Because again, I don't think men really realize all the problems they suffer. Right? Again, I just listed top 10 killers, right? And 8 out of those 10, we suffer more than women, right? So that's something that we need to correct ASAP, right? So if you're your father, your brother, your cousin, your friend, right? If you know that they haven't got their yearly checkup, get that done ASAP, right? Again, if you don't have insurance, right, go to a health clinic and get that done ASAP, right? We don't have the excuses anymore. We don't have an excuse not to take care of ourselves, right? That just can't happen, right? Because clearly it's having substantial effects, right? Again, I tell you, I'm in the rehab centers, I'm in these nursing homes. It's 2 to 1, 3 to 1 women to men, right? Because all of us are dying so early that it don't even matter. We're not even making it to the point where a lot of us can fill these nursing homes because we're dying so early, right? And again, heart disease, cancer, suicides, accidents, infection, right? Pneumonia. Again, you guys know I talk a lot about the influenza, getting your damn flu shot. Please get your flu shot. If you're not getting your flu shot, again, I don't know what to say, but get your flu shot. Unless you're severely allergic, which most people aren't, get your flu shot. Because again, it's top 10. And again, that was top 10 leading causes of death worldwide, right? This is not just a United States issue of obesity and everything else. Yes, more men are becoming more obese. This is not that, right? This is a worldwide epidemic that we're seeing here, right? Of men not taking care of themselves and having the residual effects problems later on, right? And again, if you're young, again, I quote young, if you're again between the ages of 25 to 40, right, you probably should only have to see your doctor once a year, right, for your routine checkup, right? That's all I'm asking for, right? I'm asking you to go to your doctor's office for 40 minutes, right, 30 minutes to 6. I don't know how long your doctor may keep you for a wellness appointment, and get that done, right? And this month, we're going to be talking, we're going to have a few podcast episodes. Again, we're going to have a couple more videos, Empower Yourself videos, as well as some blog posts, really hitting home the point of why men need to get their stuff together, right? That's really what it is, right? It's really nothing else to say that, really, we need to get our stuff together, and we need to do it as soon as possible, right? So again, I want to thank everyone who joined the live stream. Much appreciated. Again, if you have any questions, concerns, always feel free, go to the website, hit up, comment, DM me, whatever. We're here to help, right? That's most important, right? I just want to kind of educate you, to kind of get your stuff together. So I want you to be able to be on the lookout, because this month we're going to be having, on the podcast front, we're going to be having guests talk about erectile dysfunction. Because remember, I told you one of the two reasons why a man comes into my office is usually sexual related issues. So we're going to have that on board. Like I'm actually going to be talking about what to do when you go to as a man, right? What to do when you go and get your routine check and what stuff to expect, right? We're gonna have. I'm working on it. I'm gonna have someone talk about just the general relationships that are extremely important, right? Just from a mental health well-being for men, right? Because I think that's something that's not stressed a lot as well, too. Oh yes, definitely the STD testing. And that's definitely. And honestly, I can tell you, men and women, but usually men. Like I always recommend getting an STD test, right? Like it's just needs to be done, right? Like way too many of us are having communicable diseases that we shouldn't have or don't even know that we have, especially in men, right? Again, we'll do a quick caveat. A lot of the sexual transmitted diseases in women present in a way that they have to go see a doctor, right? A lot of times in men, we don't even realize it, right? A lot of times it's asymptomatic in us. It doesn't really cause as much problems. May get a little burning with the piss, but for us, we're so slow, we don't even think that this is a problem. So we just kind of like play it off. We drink some more juice. I've had a lots of different reasons why they like ignore it, but they do. So definitely STD testing is one thing. Like I said, next week will be a podcast episode of yours truly. Maybe somebody else. I'm not sure yet. But at least most likely yours truly. We're going to be talking about what to do for your wellness exam and to kind of get your stuff together. So quick little recap. We talked about why men's health is important, right? We talked about, the history of June and why we celebrate and how we went from Men's Health Week to Men's Health Month. We talked about the top 10 causes of death worldwide for men. We talked about the fact that majority of them affect us a lot more than women. Again, top 10 causes: heart disease, stroke, COPD, diabetes, kidney disease, Alzheimer's, infection, suicide, accidents, right? Like, top 10 killer causes for us. And it's affecting us a lot more than women. And the only thing that doesn't affect us more than women really is Alzheimer's. And that's because we're not even living long enough, right, for that to be a problem. So I want y'all guys to get y'all stuff together. Again, I am truly Dr. Pierre, board certified internist, founder of drbarrypierre.com, host of the Empower Yourself Radio series. This is episode 65. I appreciate all you guys' support, and we will see you guys. I want to say next week, but I'm looking at the schedule. I had to see, because for me in the hospital, it changes every week. So I got to see what it is. But like you'll definitely hear you'll definitely hear a podcast from me. I'm not sure if you're going to get a blog post or another video. Like yours truly. Thank everyone from Instagram, Facebook, as well as YouTube Live for joining in, and hope to see you guys later.